Today we're going to talk about the activity card sort. The activity card sort is an assessment where an OTP can use a series of cards with pictures on them to help clients determine activities they enjoy, occupations they like, and they range from things like ADLs and IADLs through different kinds of leisure activities, as well as social activities and social interactions. First one we're going to talk about is Form A, or the institutional version. This one you're going to use like when they're first administered to a setting, like be it a hospital or just after surgery, things of that nature. And you're going to have two columns. You will have a column that says done prior to injury or admission, and then you'll have one that says not done prior to injury or admission. And you would have them go through the cards, which have pictures on them. And the pictures are really to help the client, just in case maybe they're not good at reading, or maybe their literacy skills aren't that high, or their cognitive levels aren't that high. The pictures makes it just so much easier. But you'd have them go through these cards, and they take turns placing the cards in column done prior to injury or administration and not done prior to administration. And then after the client has finished sorting the cards between the two columns, you would ask them to take their 5 favorite activities, or the 5 activities that are maybe the most important to them, and place them down at the bottom. And after they take those 5 cards and put them down at the bottom, the occupational therapist or the assistant would then record the responses on a worksheet, and that would be placed in the patient or client's file for others to see in future. That way they know what kind of occupations that the client's interested in. Next we'll move on to Form B, or the recovering version. This is for the clinician to record a change in the client's activity pattern. It can be useful for follow-up or outcome studies. The 4 subcategories of activities are instrumental, leisure low demand, leisure high physical demand, and social. Now the procedure for administering Form B, the administrator would take 5 labels, one labeled not done prior to current illness or injury, continue to do during illness or injury, do less since illness or injury, given up due to illness or injury, and a new activity since illness or injury on a flat uncluttered surface. And you have the client look at all the cards one at a time and place the card under the label that applies to their level of participation in that activity. After they've completed sorting the cards, you'd have them tell you the 5 that are his or her favorites. And then you list those on the bottom of the scoring form. Then you would place a check mark on the form for the cards sorted under not done prior to current illness or injury. And next, for each activity card grouped under one of the remaining 4 labels, circle the number in the column on the scoring form that corresponds to the choices that were made during the card sort. If you have circled a number in the continue to do during the illness or injury, or given up due to illness or injury, or do less since illness injury, also circle the number in the done previously column on the right. Add all the values in all the columns except previous activity, including new activity since injury, and obtain totals for the current engagement in instrumental, low physical demand, leisure, high physical demand, leisure, and social activities. Then you add all the sectional totals to obtain a global score for the entire card sort. You would then take all these scores and you would compare them against previous tests, and you would find out how much their level of engagement has went up or decreased since the illness or injury. Now we'll continue to Form C, which is the community living version, which typically applies to people in senior centers or possibly even mental institutions that have been there for a while. It's generally for older clients. And you're going to have 5 labels for this one as well. One that says not done since age 60, one says do now at the same level as before, do less, and given up on a flat uncluttered surface. Then you'd have them go through the cards and do the same thing as they would have done if they were doing B, and then put the cards in each column based on what they do. And after they've completed the sort, you ask them to tell you what their 5 favorite activities are, and then you would list those on the bottom of the scoring sheet. The activities may be ones that they have given up, though, as well. And after you're done, to record the responses, you'll put a check mark on the form for the cards sorted under the not done since age 60. Next, for each activity card grouped under the remaining 3 labels, circle the number in the column that corresponds to the choice made during the card sort. If you ever circled a number in the do now, do less, or given up column, also circle the number in the done previously column. Add the values in all the columns and obtain the sectional totals for instrumental, low physical demand leisure, high physical demand leisure, and social activities. Then you add the sectional totals together to get a global score. Once again, you'd compare the scores and you'd calculate everything up, and what it does is it interprets the client's level of engagement and activities as an older adult.